I think I share a lot of what most of the recipients of transplants have shared with the group today, that the journey doesn't terminate after the transplant. Um, a lot of patients have lingering problems even before the transplant, either because they've had a stroke, they've got avascular necrosis, some have had depression. That doesn't go away with the transplant. So that is, even though the main nidus for the problem really goes away after a successful transplant, but some of those lingering aches and pains, some of them may still persist. I've had patients who, before their curative therapy, all they knew to do was to take narcotics. It was narcotics every day in the emergency room, in the hospital. So over time, they've developed a lot of tolerance. So after they've been cured of the disease, then the next frontier is really to help them get over the opiate use disorder. So, and you still have to tackle that. Those who have a vascular necrosis, you have to address, the joint problem. The older gentleman who we transplanted, who was 51, never knew he had bad AVN until he was cured. And he realized, wait a minute, I'm having pain in my hips more than I realized. But prior to that, he was always on pain medication and being, and being on chronic transfusion. So the bottom line is, I agree that, most patients should be part of this collaborative effort in order to, push the agenda forward. Also, understanding what happens long-term and how to improve quality of life after transplant is important. And we have one of the best people in the world with us, Dr. Deborah Friedman, to help guide some of this initiative. So I think the future is bright, both for adults and children with this disease. And I think I'll hit a pause. Psychosocial is huge after transplant. There were a few families who shared what is called financial toxicity, which can happen to some of our families. So these are things that clearly we need to focus on when the transplant is cured. Thanks.